Hey, good people. Sammy Ashe here, Executive Director of the Ashe Academy, and your host of our Inspire, Uplift, Engage podcast. This is your reminder that time is running out on our scholarship applications. Be sure to apply by September 30th, 2021. It's open to high school seniors of color pursuing the arts and STEM fields who are college, trade school, or conservatory bound. Also, our Community Impact Award is back, and it's open to students of color from high school through higher ed for those who are making a difference in the community. Apply today to join our first cohort of Ashe Scholars. Winners will be announced at our Mentors in Mimosas Gala, which is October 16th, 2021, from 10 a.m. to 2 p.m. in person at the Chester, Washington Golf Course. Join us for an amazing event and celebrate with us in the VIP. If you are a business or a small business, there are a few opportunities for you to be a vendor at our event. We have multiple levels to choose from: premium, preferred, standard. Now, if you can't make it, we also have opportunities for you to advertise inside of our event booklet. Take a look at our links in the description box, and if you have any questions, reach out. The Ashe Academy team is more than happy to help. Now, let's get started with the show. Welcome back, everyone, to another episode of the Ashe Academy's Inspire, Uplift, Engage podcast. I am Sammy Ashe, and today we are joined by friend of the foundation, Dr. Pratt. Before we get into everything, I will say on the recording that Dr. Pratt and I have claimed him as a cousin. I will give some background as to how I decided to do that. And if you are willing, we will go into the background of your name because I think it's beautiful. So I would love to go into a little bit of that. But let's see just a little intro for Dr. Pratt. He is a fellowship trained, board certified vascular and endovascular surgeon with experience and expertise treating a variety of cardiovascular conditions, including peripheral artery disease. And by the way, September's Peripheral Artery Disease, or PAD, Awareness Month.
Yes,
That's
sir.
why we're here, spreading the awareness. Thoracic and abdominal aneurysms, aortic dissections, cerebrovascular disease, venous disorders, and pulmonary embolism. That's a lot.
You got
But
through it though.
we're thankful that you have all these expertise. So let's get right into it, talking about your background and your journey into medicine. Why did you decide to become a doctor and then all these other specialties?
Yeah, so if I take you all the way back, it was probably when I was at middle school when I
Okay.
started thinking about medicine. And so when I was around that age, my mother actually told me that she wanted to be, or she had wanted to be a doctor. And she, I think, had taken maybe chemistry or organic chemistry when she was in college. She failed. She had a teacher or a professor tell her, if you don't pass this course, you're not going to be a physician. And so she decided to go a
Oh,
different route, and she ended up getting her PhD in nutrition. But when I was in middle school, and certainly when I went into high school, when I was in middle school, my mother actually was away from us. She left and did kind of a sabbatical. She was in East Africa. She went to Malawi for about 6 months or so. And I think I might have been 14, maybe 13 at the time. And that was the first time I'd been away from my mother for an extended period.
yeah, yeah.
But it was something that she was really passionate about. She spent 6 months kind of living with the people there, helping the young kids, children, women on adequate nutrition. And when she came back, she obviously shared her stories and experience with us. That kind of inspired me to want to do things to help others. So at that time, I started volunteering in a hospital, and I didn't do anything serious. I just, I pushed. I was a patient transporter, so I would, push patients from their rooms, and obviously, if they had to leave the hospital, that was my role. Is I would take them from their rooms home, and I think the most rewarding experience that I had during that time was when I used to take mothers with their newborns uh, home. So a lot of times I'd be standing there with them, while the husband or spouse was coming with the car and all the other materials and things like that. And I would just talk to them for, 15, 20 minutes or whatever,
Mhm.
however long it took. And I just enjoyed those opportunities, those experiences. And ultimately I started thinking in my mind, I want to be in this setting. This is the type of place that I want to be. And so I started talking, with friends, my mother. I had a close friend of mine whose father was a cardiologist. And so I learned a little bit more about what medicine was all about and the route that it took. And then with my parents kind of inspiring and pushing me, they obviously wanted me to go, to a good school and get good grades and things like that. So that was kind of what ultimately inspired me to go into medicine. When I got into college, I still knew I wanted to do medicine. And my first year in college, right before I started college, I found out that there was a research position in the emergency room. And it was an opportunity for me to engage with patients and talk to them a little bit about why they came into the hospital. And we had this kind of randomized trial where we would take patients, we would ask them basic questions, and then we'd have a separate group of patients that we would give them kind of a computer or an iPad that they would basically be able to click and point, and it would provide a little bit of information about, their disease process and things like that, or why they were here or what they were expecting. And I just enjoyed doing that. Being in the emergency room, engaging with patients, engaging with physicians and paramedics and things like that. And ultimately, that's kind of why I wanted to go into medicine. I enjoyed that kind of that thrill and feeling like I was helping somebody, giving back to somebody, and knew that there were opportunities that I could, kind of express my own personal talents and characteristics. And so that's why I gravitated towards medicine.
It's great. That's great. I mean, from the patient perspective, the hospital is always like a dark place, and
Yes.
like emergency room, dark place. Bad things are about to happen, or something's getting fixed, but I don't feel well. So it's interesting for you. Like I was there, and I loved it. I was helping people. It's like I have a completely different experience
Yeah,
of that.
yeah.
But no, that's great.
Well,
We need people to love it and want to be there because nobody will get better without
right,
that existing
right,
in this world.
yeah, right,
My
absolutely.
gosh. So did you have any great mentors along the way? I know you had the support from family, but like teachers guiding you into medicine. Um, like how did that work out? Or were you like me, you didn't really have mentors? It was kind of pure
Yeah,
uplift.
I didn't really have any direct mentors until I got into medical school.
Okay.
When I was younger, my father was probably my biggest mentor. And my brother too. I kind of look at my brother as my mentor too, in a lot of ways. And he and I are 18 months apart, so he's actually younger than I am. But um, I really valued his perspective, and he was in college, obviously, the same time that I was in college, and so we would talk often. I think we started to get much closer when we got into college. We were close before. In
Hmm.
high school, I think when you're close in age, sometimes you fight a little bit more. So we kind of got a little bit distance, but then when we got back into college, that's when we really got close and spent time together. So I would say he's a bit of a mentor. Definitely my father was a mentor. He hadn't done anything in the medical field per se, but he had certainly a passion for teaching and helping others, and so he kind of pushed that on me, and I think it was helpful. So those are my two mentors, I would say, when I got into
That's awesome.
college. When I got out of college and when I was in medical school, I had two great mentors when I was a third year medical student, and I still talk to this day. Actually, one of them I spoke to, his name is Dr. Charles Vollmer, or Chuck Vollmer, and he's a surgeon in Pennsylvania. He's at University of Pennsylvania, and he kind of took me under his wing. I did a rotation. We do third year rotations where you spend a month to 3 months on a specific rotation. So at that time, I did surgery. There's other rotations like you do OBGYN or obstetrics and gynecology. You do surgery, you do medicine, you do pediatrics. But he was a great mentor to me. Kind of took me under his wing. Um, showed me a little bit about what it was like to be a surgeon, what it was to help people. And then I actually ended up spending a couple of years working with him. I took some time off in medical school to do some research and got another degree, but I also worked with him during those 2 years. And he became more than a mentor, more like a friend, but certainly a mentor.
Hmm.
And I think those are the type of people that you really want to follow. because I really admired the way that he was, one, with his patients, two, with the people that he worked with, not only the people that, not only his direct colleagues, but also some of the staff members that worked for him or worked in his office. I really admired the way that he was respectful of them, valued their opinion, always made it a point to make sure that that they had a voice in what was going on with the patients that they were caring for. And he was great. I mean, he took me on meetings. We went to various meetings across the country, whether it was in Florida or in California, um, elsewhere. He would take me on those meetings, and he would introduce me to people. So he did a really good job of networking. Um,
Awesome.
and surprisingly, I mean, a young person like myself, having somebody of his caliber just supporting me really gave me the confidence. Um, and ultimately, I chose to follow his route when it came to where I was going to go after medical school.
Okay.
And that's when I went to Washington University, St. Louis for residency, because that's where he had gone. And naturally, you almost want to follow the people or do the same things that the people that you value and that you admire. And he was one of those people. So he inspired me certainly to go to St. Louis, and that's where I kind of um, I didn't have mentors really when I was in St. Louis, but it was after St. Louis when I went to Houston and did my fellowship there that I had another mentor, Dr. Hazem Safi, and he's chief of cardiovascular surgery at University of Texas, Houston. And I text him every day, or he texts me every day. But he's just a gentle person, very strong. Um, he's great with his staff. He knows how to kind of deflate. When things are very tense and excitable, he knows how to kind of deflate the scene and make sure that everybody's calm. And I really valued him as well. He's very smart. I mean, he talks about everything from politics to you know uh, just social issues. I mean, he's
Hmm.
very, very smart, and I really valued him. So those are probably the two big mentors that I had when I got into the field that I'm in now. So there's also a couple mentors that I've had recently as I joined the current practice. Dr. Jeff Martinez is one of them.
Awesome.
He's kind of become a mentor to me too. He calls me often, and he's a vascular surgeon as well, but he calls me often just to check in on me, and I really value that too. So
Well, we have to say this is a Modern Vascular takeover. You could see the logo on Dr. Pratt's
that's
scrubs. But
right.
no,
That's
shout
right.
out to Dr. Martinez. Are there any other physicians that you are in community with at Modern Vascular that are mentor um,
Yeah. So
relationships?
yeah, Dr. Dallas Broadway was one of the first surgeons or first interventional radiologists that I met with um, with Modern Vascular, and I know he's moved on, but he was certainly a mentor to me, and somebody that I really valued, quite a bit. And I still reach out to him from time to time about patient care and some aspects like that. What should I do in this circumstance? And when you have people like that you can lean on or turn to, I think those are kind of rewarding experiences that you really appreciate. Um, but outside of that, yeah, Steve Lashak, one of the other modern vascular physicians, he and I spent 6 months working together. We had a great relationship, working in the Memphis area. He's still a mentor in a way. And, he tells me, especially since I just opened this lab in St. Louis, he's been able to provide me a little bit of background and support, certainly when it comes to the issues that arise and things that you need to do to make sure that you're still giving good quality care. So yeah, Dr. Jeff Martinez, Dr. Broadway, Dr. Lashak, and I think those are the three main mentors. And then
Awesome, awesome.
um, David Prophet is one of the CRNAs that works with with us, and he has a group called Vascular Anesthesia Associates. He actually does a podcast as well. Talks a little bit about anesthesia aspects and things that patients and people should really know about. But he's also
Awesome.
become a great mentor as well. He's somebody that I talk to frequently, and since I've been at so many of these labs, this is now my fourth lab. He's actually been at all four of the locations helping support not only me, but also the other physicians that are at those labs and help with the nurses. So yeah, he's another mentor too. obviously you can't get to where you want to get to without mentors, in my opinion. You know, it's
Mhm.
nice to have people that can really support you. So
Absolutely, absolutely. Now, you said something and we kind of breezed by it. Stopping med school or taking a break from med school to get another degree. Um, I already know about your credentials, so it's not a surprise to me that you got another degree. But I'm wondering, kind of like, what is this the norm to get another degree as a physician? Um, and this is public health, right? Masters of
yes,
Public Health.
yeah,
Okay, so
yeah.
what was the decision there and kind of the reasoning behind getting that degree?
Yeah, so it was when I was a third year medical student. A lot of my co-medical students, I would say probably about a quarter, maybe 20%. So 1 in 5, maybe 1 in 4 would take either some time to do additional research or get another degree, whether that's a master's in public health, an MBA, or a PhD. And I think that was something that was certainly when I started medical school, it was something that they talked about, that was an opportunity to do. But I looked at it when I was in medical school. I looked at it as just kind of enhancing what it was that I was already doing. I became very, when I went into medical school, I didn't think I was going to be a surgeon. I really wanted to be a pediatrician.
Oh,
That was my focus, and I love working with young people, still do. Um, but when I joined medical school, that was my sole focus. And some of the projects that I picked up on were devoted to kind of public health issues because I obviously I feel like and a lot of people feel the same way, I think, but there are a lot of issues that are affecting African Americans and those people of color, particularly when it has to do with health. And that was something that I had a hard time really understanding or really just being okay with. And I wanted to find out why this was occurring and ways that we could change this. One of my first projects was looking at HIV um, uh, uh, penetration within Black communities and what could we do to try and reduce that.
hmm
So I joined a project. It was associated with St. Louis Children's Hospital. I'm sorry, Boston Children's Hospital, and we went into different locations, schools, communities, organizations, etc., and just did some focus group testing, talk to people, talk to them about their practices, their habits, their background, things that they are exposed to that affect their socioeconomic status, but also there's things that they're exposed to that affect their decision making.
hmm
And it became a very very to me it was very important. I really enjoyed that opportunity, but it kind of set for me the goal that there's more that I can do just with direct patient care. There are things that I can do outside of that, and looking at public health was one of those aspects. So when I started my third year rotations and I worked with Dr. Volmer, we started talking about some projects that I could do from a public health standpoint. And I first started by doing a year of research. It was a dedicated research program where, they pay you a little stipend so that you can, make your, uh, you know, support yourself, but it allows you to have dedicated time to work on research. And I focused on how could we improve the quality of care for patients that receive surgical operations. And that's where I started. Broad topic, obviously, but Dr. Vollmer let me use kind of his experience, his office, his practice as a substrate, and I began to analyze closely some of the things that he did and helped him work closely with his patients, both in the hospital and in the clinic, and gave us an opportunity for us to travel a little bit,
hmm
go to conferences, etc. And then it was after that, then I said, you know what, this is an opportunity for me maybe to take a second year off and I'll go and get that degree. So I have the credentials if I ever have to talk about this or publish or do something on an official standpoint. So it was that was the opportunity that kind of drove me to get the other degree. But to answer your question, yeah, I'd say there are a fraction of patients or people that do take some time off, but it has to be something that you're committed to because it is extending. Instead of me finishing medical school in 4 years, I had to, it ended up being 6 years because I took 2 years off and did some research. So you do have to be committed to it a little bit.
I find that so interesting, but very impactful if it makes you a better physician in the long run.
Yeah.
So I guess the for the students out there who are considering med school, what would you say to them, especially if they might be in your footsteps, where you consider getting a master's of public health or
Yeah.
specializing in something else? Yeah.
Yeah, I think, and I tell, my son is 15 now, but I used to do when he was in middle school, I used to go to his school and talk to young people about what it was that they needed to do to get in, for career day. What could
Hmm.
they do to get to, go into medicine? And, I think for whatever your students or any of the students out there are thinking of, I think the first thing is you have to be passionate about what it is that you want to do. And medicine is not one of those things, or becoming a doctor is not one of those things that you can say, you know what, I might do it, or you have to be fully committed
Please
because
don't if you're on the fence, people. If
yes, if you're on the fence, you need to get off the fence. And you cannot. And it's not only because I mean, other people's lives and care are in
Exactly.
your hands, but it is a long. It's not a sprint. It's a mile. It's a marathon. It's going to take you a lot of time, um, a lot of things that you're going to miss out. I missed my brother's college graduation. Either his college or yeah, I think I missed my brother's college graduation. Um, things like that occur that that you really miss out on because you've got commitments, and you've got to surround yourself with people that not only understand that but are willing to support you. So but yeah, if you're going to do medicine, you got to be fully committed. um, but it's a very rewarding field because every day I'm challenged, but every day I feel like I get to make a difference. And particularly in the field that I'm in, where we do things or procedures where we essentially will have sometimes instant gratification or instant results, and we'll know exactly if we've made a difference. Um, so it's rewarding when we have those experiences, but there also are some, as much as there's some major highs, there are some lows too. You're gonna not always be perfect. If you're somebody who's very hard on yourself, which I am, it can be hard because if you have any failures or if you have complications or difficult circumstances for you or your patients, it can weigh on you. It can keep you up at night. You can lose weight, you can lose sleep because you're thinking about the impact that you've had on patients. But there's a couple of items and things and moments that I've had even recently where it constantly reminds you that I made the right decision because um, patients and their family members really value the sacrifices that you put forward. So
Awesome, awesome. When you were in Fort Worth, I did have an opportunity to speak to some of your patients and do some testimonial videos. So they had very great things to say about you across the board, whether they had had a procedure and seen you multiple times, or it was just their first consultation. So, you know, rave reviews across the board.
that's great. That's great.
And it's very refreshing for me, just as an outsider, not actually a physician or any medical professional, to hear nothing of the sort regarding money, because culturally, or within our community, it's always like, go for those degrees that are going to be high paying, and like that's what we're worried about, like making sure that you're stable and whatnot. And it's been great to hear from you and Dr. Jean Baptiste. It was patient centered. It's all about who I'm impacting and nothing to do with any of the other implications that career denotes for people whenever, oh, you're a lawyer, oh, you're a doctor. Like, I'm worried about the people. That's my focus. I love hearing that. That's super important.
Yeah,
So
absolutely.
speaking of the people, and since it's PAD Awareness Month, let's go ahead and do a little segue into what exactly peripheral artery disease is and why it's so important for our community and communities of color to be aware of it.
Yes, absolutely. So yeah, September is PAD awareness. So PAD, is an abbreviation for peripheral peripheral arterial disease. So very similar to what people may have seen, CAD or coronary artery disease. Peripheral arterial disease affects the arteries within the periphery, so usually within the legs or in the lower extremities. It's a hardening of those arteries, it's plaque buildup, it's blockage, it's narrowing, essentially, that occurs within those arteries. And those arteries down to the foot, down to the legs, uh, the circulation and blood flow is significantly reduced, and ultimately patients can experience symptoms because of that reduction in blood flow. Imagine it's like your legs are starving for more oxygen, more blood, and they're not getting it. And so patients can develop cramps, they can develop pain, they can develop swelling, they can develop numbness. At its worst stage, you can actually develop sores and wounds on the feet and on the toes that just don't heal. And lastly, it can ultimately result in major amputations where you have to lose toes, maybe even ankle or foot, or even part of the leg, because the tissues are so infected or they're so diseased, or even in patients whose pain is so severe that the only thing that can take away the pain is an amputation. So it's a significant problem. It does affect approximately 12 million people in the US or in the United States, but it has it predominantly affects people of color. So African Americans and Hispanics tend to, Latinx tend to be affected the most. Males over the age of 65 as well, smokers, patients that are diabetic, high cholesterol, morbid obesity. Those are some of the risk factors that can be attributed with PAD. And at its worst stages, it can lead to amputation or even death if not treated. So, um, and from a personal standpoint, I have family members that have diabetes. I have family members that have renal problems. I've had or kidney problems. I have family members that have lost limbs, and it not only affects um, the patients or individuals as a whole, but it affects the family members too. Sometimes modifications have to be made in terms of the home or activities that they can and can't do. So it's a big problem. And unfortunately, it's a growing problem. If you asked me 10, 15 years ago, the number of people that were being affected by this disease, you'd probably say it's probably closer to 5 million, but now we're seeing that number is rising. And part of that is because of the rise in diabetes, particularly within the African American community. Um, you know, Diabetes is a progressive problem. It doesn't just, the effects of diabetes don't just occur instantaneously. It can take many years, or at least months to years, for those effects to occur. And if left untreated or poorly treated, can result in significant complications for people, including infections, ulcers, and the things that we just discussed. So it's a big problem. It definitely is a big problem. I'm glad we're bringing some awareness to that this month, and to some of your listeners and those that are in the audience. I certainly would ask them just to, if it's not them, certainly talk to your family members, uncles, aunts, grandparents. Just make sure that they're healthy and that they're feeling okay. They may have minor ailments that might be an indication that they have PAD. Pain in the legs, pain when they're sleeping, pain when they're walking. They may have a cut on the bottom of their foot or on the top of their foot that just doesn't heal. Those are signs that we may need to get involved, or we may need to seek medical attention because they may have a significant problem like PAD.
Absolutely. I mean, ever since I started working at Modern Vascular, I've turned into an advocate for my board members.
Yeah.
I've been like, hey, get a second opinion if the these diagnosis means amputation. I'm like, or if you're starting to feel pain, if
Yes.
yeah, all these symptoms, I'm like, okay, we're gonna have a conversation. Even if we're at a party, we're enjoying ourselves. All right, guess what? Let's have a moment for some health check-ins. Make sure
Yeah.
that you are going, getting checked out. I'll be a Debbie Downer for to save a life. Let's put
Yes.
it that way.
That's great. That's great. We got some champions out there. Appreciate that. That's good.
Absolutely, absolutely. So what does treatment look like? Because I have heard that not everyone gets gets a procedure. So what's kind of the difference there?
Yeah, usually it starts with lifestyle modification, and what we mean by that is just making some minor changes in their habits. So, exercise and diet and exercise. I mean, it's like always the same thing that we say. As a physician, I'm somebody who also cheats. Like I like my sweets. I like things that aren't always healthy. But what we say is with moderation. So, try if you can cut down on the excess. So if you're somebody like myself who likes sweets, don't have it every day. Maybe have a couple times a week, and just limit yourself. So you're making that minor modification can be a significant change for you. So we start there. We say, obviously improve your diet. So less high cholesterol items, high fatty foods, less sugar. Instead of drinking sodas, drink water more often, or things that don't have a lot of sugars. um, to stay away from always eating, like if you eat French fries a lot, or if you like fried foods, cut down. You don't have to eliminate it, just cut it down, and just focus more on some of the things that are a little bit more healthy, like salads and fruits and vegetables and things like that. And then uh, uh, then we start talking about, some medications that we can administer. So patients will oftentimes be on something like an aspirin or something a little stronger than an aspirin, and that can help prevent the blockages from occurring, the hardening of the arteries. We want patients to take a medicine for cholesterol called a statin if they can tolerate it. What that does is it prevents the buildup along the walls of the arteries. So if patients are taking or eating or consuming high fatty or high cholesterol foods, the statins can help prevent that from damaging the arteries in your legs. And then if you're a smoker, we tell patients, I'm a realist. I tell patients, if you smoke a pack a day, try and cut down to a half. If you smoke a half a pack, cut down to a quarter. If you can eliminate it altogether, that's great. But realistically, it's hard to do that. So we do our best. You tell patients just to do your best, cut down on a little bit. If you can cut down by half, that's great. If you can cut it or eliminate it altogether, that's the best. Same with weight loss. If you can lose a little weight, that helps. It gives you a little bit more activity. You're able to move around a little bit better. You can walk, you can exercise. Those things can certainly prevent PAD from causing long-lasting symptoms and complications. So those are the two strategies that we start with. Certainly making some modifications in your lifestyle habits, but also reducing some of the risk factors. So smoking, cutting down on diabetes, making sure you're on an aspirin or a statin to help with cholesterol and deposits of plaque within the arteries.
And then if someone is in a position where they need to get a procedure, what do you tell patients in preparation for that?
Yeah, so we make that determination based on a number of factors, or I make that determination. But one of the first things we look at is the patient having symptoms? So we have to first determine, are they having minor, moderate, or severe symptoms? And patients will come to you and they say, they've got some knee pain here, or a little ailment there. That might be very mild, and it may not necessarily be related to PAD. But sometimes patients will have severe symptoms that they may not talk to you about right away. It might have been something that they've had for years, and they just attributed it to old age or getting older. Um, and then when you talk to them and kind of figure it out, you can hear some of the ways that it's affecting them, and you might ask yourself, well, this might be related to PAD. So after reviewing the patient's symptoms, doing an exam, we'll get some objective evidence of some type of imaging study. And usually we start with an ultrasound, which is something that very simple, very plain. If you've ever had, for anybody who's had a baby, it's ultrasound that goes on the stomach, or if you've ever had an ultrasound of the heart, to look at the heart, it's very similar. Essentially, it's just a little bit of gel that we put on the extremity or on the leg, and then you take a small ultrasound probe, and then you just mark down or go down the leg. So it's not a painful thing. It doesn't hurt. There's nothing that's invasive. There's no needles or anything like that. But it gives us so much information. It can tell us exactly what the blood flow looks like. It could tell us where there might be hardening within the arteries, where there might be plaque buildup. And if those two things are positive, so the patient has symptoms and the patient has findings on an ultrasound that are suggestive of PAD, then we have a conversation in the office about doing an intervention. I'd say about 25 to 35% of patients who come in with PAD will require some type of intervention. So the majority of patients don't. I'd say three out of four patients probably don't receive or need to have any intervention. And most of the time we can treat this without having to do any procedures or make any decision. But if they do, and that 1 out of 4 patients that do require an intervention, the great thing is that now our technology has advanced so rapidly that we're at a point now where we can do these procedures safely in a matter of just an hour or two without having to make a large incision or have to require somebody to be in a hospital overnight. We can do that in a facility like ours, where they come in, they have the procedure and leave the same day, usually with us just 3 or 4 hours, with minimal pain before, during, and after the procedure. And it's lasting. It's durable. It lasts years. It's not something that just lasts a couple months, but it's something that's very durable and is highly effective. So I'd say 90% of patients that come see me and need to have an intervention, 90% of those patients can have that intervention in a minimally invasive approach where we don't have to make an incision, you don't have to have a cut, you don't have to be put under anesthesia or under deep anesthesia. And you can leave within 3 or 4 hours, and you can come back to our facility the following day or a week later, and you'll have an improvement in your symptoms. So that's the advancement, and that's what I really enjoy now, is that we're now bridging technology and our advancement in technology with ways to benefit patients. So I know there's a lot of patients, particularly patients of color, who might feel like going into a hospital is not the type of thing that they want. I know my mother-in-law and my father-in-law, they hate going into hospitals, particularly as they're getting older now. A lot of their friends and people that they grew up with, are either going into the hospital and getting sick, or going into the hospital and finding diagnoses, and ultimately are ending up, in difficult circumstances. So it can be very stressful for people. It can be something that they're fearful of. But coming to a facility like ours, again, I'd say the majority of patients aren't going to receive an intervention. We're just going to help them make some minor modifications to improve their quality of life and just improve their overall symptoms. So, your audience members and others should realize that just by coming in to see a doctor, you're taking that first step, and you're not committing yourself to anything, but you are taking that first step. And I think that's great.
Awesome, awesome. I'm going to go deep for just a quick moment. When we say that you're saving limbs and lives, it's how does that impact you? Like, how does it make you feel that you are essentially saving people's lives? Um, I know you mentioned how rewarding it is to help people, but like essentially you're improving the quality of someone's life. Um, how
Yeah.
does that make you feel?
So it's what's the saying they say, with much responsibility, I don't know, with
As much power, there's
much
much
power,
comes.
yeah, something along those lines. But what it makes me think of, the first thing that really makes me feel, it is a huge responsibility. We're giving a lot of ourselves to patients, but a lot of patients are expecting a good outcome, and in some circumstances, you have patients that are expecting miracles. The best thing I can do is provide them with that option. Uh, I think it's such a rewarding opportunity that when you have somebody who comes to you, who might have been told no, and you're telling them, you know what, I'm going to give it a shot. You know, and you always want to do it safely. You don't want to subject somebody to the worst outcome or to a bad outcome, but you do tell them, you're honest with them, and you say, I'm going to give you a shot. And when you reach that success, or you achieve a successful outcome, it's very rewarding. It's one of the best feelings you have, just because you saw them at their worst and now have taken them to a place where they can get better, whether it's interacting with their family members and loved ones more often, they're able to do more activities, or they just don't have to live in pain. I've had patients who they tell me, I couldn't sleep 4 or 5 times a week. I'd be waking up in the middle of the night. I'd never get any sleep. You'd have patients who come in and tell you that this is just excruciating. It's the worst pain in their life, that if this doesn't work, that they'd be willing to do something as drastic as cut off their limbs. And when you can prevent that from happening, or you can reverse the course of their pain, it's very rewarding, because how difficult it is for them, but you're also getting them to a point where they can make some improvements in their life. So you ultimately, as a physician, as a provider, you do take on a lot of that. Sometimes I go home with it, you know, and that can be stressful, because you don't want it to affect your mindset too much, especially if you've got people around you that do rely on you. You've always kind of have to have a level head and be calm, but it does weigh on you sometimes. And there are times when, even before a procedure or after a procedure, I'll be up in the middle of the night thinking about that particular patient. Unfortunately, you tend to remember, it's like an athlete, I guess, or a professional athlete. They tend to remember the losses more than the wins. And that's kind of how I am as a provider. You tend to remember the ones that had more difficult circumstances, or when you were not able to achieve the outcome that they wanted, where you weren't able to save their limb, or even with everything that you did, they still had to have an amputation, or they still lived in pain. Those are the ones that you remember. Those are the ones you think about the most. It's very rewarding when patients send you text messages, or give you a call, or send you a letter or a card, or give you a gift, or bring in something for the staff. That's rewarding. But I don't do it for that. I mean, I do it because I want to help the people. But the ones that I think about in the middle of the night, yeah, those are the ones that I still think about. Some of the patients that I wasn't able to help with all my best efforts. I still couldn't get the circulation opened, or I couldn't open up that particular artery, and they're still living in pain. Those are the ones that stick with you.
I mean, I bet it is tough, but I feel like your successes do outweigh those um, less than positive situations that were essentially could have just been outside of your hands. So,
Yeah.
you know,
Yeah, so my mentor, Dr. Safi, Hazem Safi, he used to always say that was kind of the nature of the beast. Sometimes you had patients, he would oftentimes say, because we were at a center where we would have patients who come in, a ruptured aneurysm, or, they'd have like a chest full of blood, and they
wow.
would come in, and you would, you'd swarm that patient, you get them down to the operating room, everything would be efficient and to a T, and you'd give your best effort. You'd be up in the middle of the night at 2 o'clock working with the ICU nurses, trying to pump in fluids, and everything that you did, as hard as you worked, and you still didn't save somebody. Sometimes you get those circumstances, and Dr. Safi would sometimes say, that's just the nature of the beast. There's only so much you can do. You give yourself, but you have to realize that you can't reverse the course of action that God had intended. Um, sometimes as much as you give yourself, that's just how things are. So you're right. Yeah.
Well, what does self-care look like for you? Let's try to liven this, liven this
That's a
one.
great segue. That's a great segue. We don't want any doom and gloom here. Yeah.
Yeah.
So self-care, I think, and that's the one thing. I was looking at some of the questions that you sent. The one thing that I want to impart on your audience members, listeners, et cetera, is that, you have to, I think, as a physician or as a provider, I'm looking for that balance too, that perfect balance between, being able to take care of my family and being able to enjoy aspects of my family, and also marry that with, or merge that with, my ability to take care of patients. Like, I can devote all my attention to my patients and sit here till 9 o'clock in my office reading this and doing that, but I'm missing my kids, I'm missing my wife, I'm missing my friends, and you know, I don't want to be 20, 30 years from now and having missed out on many opportunities. So self-care is very important, and I am probably the worst at that. You know, there are times that I don't uh, take very good care of myself when it comes to, you know, diet and exercise, stress level. You know, I have high blood pressure runs in my family, and my mother's very worried about me. Her father passed away from a stroke due to high blood pressure. She has high blood pressure. When I was in college and medical school, I got diagnosed with high blood pressure. So I've had high blood pressure since a young age, and I'm on three medications for that. So um, you know, I'm not taking great care of myself. I am seeing a doctor. I am getting on the right medications, and my blood pressure has been great. Um, but I do know that the reason that my blood pressure is high is because I'm in a uh, stressful job, a stressful employment. So there's a lot of stresses, and I think that certainly raises my blood pressure. But I have to do the things to kind of counter that. So recently, I mean, the last probably year and a half, I work out, I exercise in the morning or as much as I can. I think that's important. But just taking some time, like just taking some time for yourself, to self reflect, whether it's, consistently, maybe every 7 days, just take some time off from work or whatever. But really, I think it's daily. You have to find moments. I have I have this book here. This is a book that a patient gave me. Um, it says Jesus Calling, but it's devotions for every day of the year. And I read this every morning. It's a patient that I saw. I remember her, Miss Williams, a long time ago. She gave me that book, and I try and find 5 minutes every day to kind of read that. And then throughout the day, I try and find moments where I can call, my wife or speak to my kids. So you have to have like some work life balance. I think in order to do this job, you have to have some work life balance. Sorry
Absolutely,
about that. I don't know
absolutely.
if you can hear that. That's a lawnmower.
Oh my gosh, you're good. You're good. You have such a calming voice. So, I can connect on so many of those self-care moments where you're like, I know what I should be doing,
Yes.
but I
But
have
I'm
a lot
doing
of work to do.
yes.
So, in the midst of the work and finding that balance is super important.
Right.
And we don't always find the balance, but it's okay as long as we are working on getting there and making
Yeah.
strides, just like with patients making their strides for their lifestyle changes and
Right. Right.
following instructions after procedures and all that stuff, answering calls as they're being checked
Yeah.
up on. Like all of these things are super important. And I'm saying that from the perspective of a patient who has been through a procedure and not being too happy on how much money I had to pay each time, but acknowledging afterward, like, oh wait, if you had not seen that infectious disease specialist, things could have gone wrong. You could have not been here. So
Yeah.
let's make sure you're listening to all of these things
Right.
that are
Right.
being told to you. Go to every meeting that's required of you.
Yes.
Um, so let's segue into some much lighter moments. Let's start out with the background for your name, your first name, or actually, first and middle name.
Yes.
You did go through it, but please, once again, because I feel like I'm gonna mispronounce things, I don't want to do
Yeah. Yeah.
that.
So my first name is Baba Femi, and my middle name is Baba Wande, and obviously my last name is Pratt, but Baba Femi, Baba Wande, Pratt, and it's Yoruba, so in Nigeria. My dad's from Lagos, and actually my mother is from Ghana. So
Hmm.
my parents are both from West Africa. Met when they were college students here in the U.S. and um, then my brother and I were born, 3, 4 years after they got married. But um, my grandmother on my father's side named both my brother and I. And the interesting thing is my father's father, so my grandfather, who I never met, died at, sometime when my father was like in his teens, maybe when he was 15. So there's two parts to my name. Obviously, Baba Femi is my first name, and that means God loves me or our Father loves me. And my middle name means Baba Wande is our Father or God returns to us. And so the second part of my name or my middle name really reflects the thought that I was somewhat of a reincarnation, I guess, of my grandfather. Uh,
Mm,
and so that's where I think that part of my name came from. With regard to my first name, Baba Femi, God loves me or our Father loves me. I think it's a common name. Actually, Femi is a very common name, and Baba in Yoruba means father or God. It's common in other languages too that Baba or Abba can signify God or
mhm.
father. So that's where it comes from. And Femi loves me. So that's kind of the origin of my name. And my brother's name is Abimbola Babalola, and his first name he shortens it to Bola, but means God brings wealth. So my brother, God
Is
loves
he in
me.
the financial industry?
No,
Okay.
no, no, but he does well with his money.
There we go.
He knows how to invest a little bit better than me. So, yeah,
We love to see it. We love to see it. So the background, I'm not just calling you a cousin for absolutely no reason.
that's all right. We are
there,
cousins.
there is a reason. So the first episode this season, we did an episode on the African diaspora, and one of those members is from African Ancestry, an organization full of Black scientists who do the genealogy tests to give specific people within regions and all of the countries within Africa. Um, so I found out on my mom's side, we are Yoruba, and I was like, oh, when you
Oh,
told me the history, I was like, yeah, we actually are cousins. I
there
didn't
you
just text you for no
go.
reason.
That's
So yeah,
wonderful.
that was super funny that you mentioned that your mom was Ghanaian, though. The Jollof Wars. Is there a preference between Ghanaian or
Oh,
Nigerian
definitely my
Jollof?
mom. Definitely, and not even my mom's actually. My mom's sister, so my aunt or
Mhm.
auntie, who I'm looking forward to seeing soon. But she makes the best jollof rice. She makes the best, better than my mother's, better than my grandmother's, and yes. So
I have yet to try any Ghanaian one, but I have been picking the side of Nigeria. So it was, as soon as I get an example, then I can change my mind. But
I'm
Well,
gonna have
awesome,
her send you
awesome.
some. I swear.
Please, overnight ship. I'll pay for it all.
Yo, she'll
Uh,
make she'll make it happen, and that won't be the last time you'll take it to. She makes it great, though. She's wonderful. So
and I'll break my vegan diet. Everyone on. I'm not gonna ask for a vegan version. I want the real.
I'm sure she can make a vegan version. She can make a vegan
I
version.
want the regular one though. We don't have to tell anybody that I broke the diet though. Uh, okay,
Uh,
on to much happier things while we're in this vibe. What is your idea of success, or what does success mean to you?
Yeah, I think success is. I think it's hard to define for every individual, and even if you ask me, like 10 years ago, what was, or 15, 20 years ago, what did I think? Or how would I define success? I think initially, just coming from an academic family where both my parents were teachers and professors, you know, academic appointment was considered for me the definition of success. So I wanted to always go into a field that would propel me into, hey, he's going to be a professor of this or a professor of that, or he's going to be publishing this or writing books on this. And it wasn't really until I met Dr. Safi, and Dr. Safi is heavily published and has written thousands of book chapters and probably one of the most world-renowned cardiovascular and cardiothoracic surgeons that in the country and in the world. Um, but he kind of helped me realize, what personal success really is. And um, when I was able to start framing my mind and start thinking about, well, what do I enjoy? What do I get the most enjoyment out of? And it's not the books that I write or the chapters that, or the papers that I publish or the presentations that I do or the speaking engagements. All that stuff to me was actually, uh, it really wasn't what what drove me. What drove me was every day being able to wake up and make a difference in people's lives. And that still is what drives me. That's why I get excited and passionate. That's why I really enjoy being in this space, because I feel like I can really fully give myself to the patients that come in to see us. And that's the one thing I really enjoy. So it's not the success. The way I define success now is it's probably on a daily basis. Did I help make somebody's day better today? Even if it's just one person, somebody, a staff member, a nurse, one of my medical assistants, a patient's family member. Did I make one person better today? And it's not always easy to do that, but that's how I define success. Um, and then, I just how I also define success is just being able to take care of my family, not from a financial standpoint, but just be there for them. That's not something that I've been able to do, especially recently, since I've been traveling so much for work.
Shout out to your family because I've known of everywhere that you had to be for work.
Yeah, yeah,
Yeah, so
yeah. So now I feel like this is an opportunity. That's why I'm so happy and thrilled with where I am now. It took a long time to get here, and I'm not saying that I'm done, but that my life and career may not change. But I'm very happy that now I can be there for my family. You know, because not only, I mean, I think they were fine without me. I'm not saying that they need me to survive, but it was really important for me to just be able to see my daughter, see my son, see my wife, be there for them. And sometimes even the times that I enjoy the most, it's not, going to this restaurant or seeing this show or spending time in this city, vacationing. It's just actually just being home, where I can wake up, like this morning, I can wake up and I can see my kids, or I can go home at the end of the day and pick them up from school, or, have dinner with them. Those are the things that, and especially with, I mean, with COVID, you start to realize just how displaced and how you missed some of those opportunities. And so that's how I define success now is, yeah, did I help somebody? Did I make somebody's life better? And was I there for my family? Was I there for the people that, my loved ones, the people that care the most about me, and the ones that I care, or the people that I care the most about? Was I there for them? And so that's how I define success. So.
beautiful, beautiful. Now, outside of your work, so no work-related answers, what brings you joy?
What brings me joy? I love sports,
Okay.
and I
Feel
love.
like we got a reference.
Oh
You're
yeah.
you're aware.
That's right. I do love sports. I've always had this kind of, and I think people that know me very well would probably say I got a bit of an obsession with it. I wish I was like a sports talk radio personality, but
It can
or
still happen. You could do your own
no,
podcast.
no, no, or a sports announcer. I love sports, so I enjoy kind of like, just watching sports on many levels, like soccer and basketball, football, and I enjoy that. That's probably what brings me outside of like my family. Obviously, I love my family, and we've talked about that, but what I enjoy doing, what gives me great joy every day is, just watching and experiencing sports. So
Is it the competitive nature of it, or like what? Because you're saying multiple different types of sports, so I
yeah,
guess
I think it's just like, and maybe it's like now I start to relate sports a little bit too much to what I'm doing, but you know, like
on the way, yeah,
yeah.
something to work.
So I just like the realness of it, how much people have to give to, to reach their goal. Either it's a team sport where you have to rely on so many individuals, your teammates, to be able to accomplish something. I love seeing that, that drive, the things that that captivate people to want to push themselves further than they thought that they can go. Um, I love how success and defeat. So, if you win, how it affects you, because of all the sacrifices you put into it, but also how when you lose, I mean, especially in my field, it's not a straight path. You don't get to, um, you know, wherever you get to, you don't get to just on a straight path. You're going to have highs, you're going to have some major lows, you're going to have failures, things that, and if I gave you my full bio, there would be, ups and downs and moments where you were just like, man, I don't know if I can do this. I mean, when I was a second year medical student or resident, second year resident, I really thought I was going to quit. You know, I gave serious consideration to quitting because I wasn't happy. I just felt like I was not in the right space. I wasn't in the right place. Uh, and I really contemplated quitting. And I feel like in sports, people think like that. Like it might be so tough, whether it's a loss that you had that just emotionally takes you. You see people when they lose a big game, and you think to themselves, why are they crying? Well, they gave their all. It was everything. I had moments like that. And I think we all have moments where we're extremely down, and it got us to a point where we were either crying or it really hurt us, and you were down, like you were depressed, and you just could not get out of it. And that's how I can relate, is that through sports, people are able to kind of pick themselves up, try again. If they lose, they get back right up on the horse and do it again, and put themselves out there. It's a vulnerable place to be. And I admire that. I appreciate that. Both in team sports and individual sports. Um, I think it's probably more of an escape too, because uh, you see so much in sports, or at least I see so much in sports that's good with um, with this world and this community. I think, you see people of all different colors and backgrounds and, statuses just giving themselves together, working towards a common goal. And, very rarely do I see moments in sports that disappoint me. I think people support one another more than they bring other people down. And I think it's nice to have that on a consistent basis. And hopefully, I can apply that to my life, and I'll apply that to what I'm doing here. But yeah, somehow I feel like I turned this joyous moment into a negative. I don't know what it was, but I'm gonna tell you, I do love sports though. And I love all kinds of sports. And because I probably lived in so many cities, that's why I wear so many of these hats. So, you know,
Awesome, awesome. Well, I think this is the perfect time to segue into our final Q&A. Are you ready?
I don't know. Yeah, I'm ready. I'm ready.
Okay.
Give it to me.
All right. So, who is your biggest inspiration?
Oh, wow. Wow. You know, I I have to pick one person, huh?
I mean, you can give your greatest hits. It'll be if someone were to ask me, you're getting a list. So
Yeah.
there's not.
So I would say probably in this order. First, my mother. My mother continues to inspire me, and but my brother too. I'm tremendously inspired by what my brother is, what he's become, who he is, how he is. There's people that know my brother that have come to me and said, "Man, your brother's pretty awesome." And I say, "Yeah, I know. I'm very proud of him, because he also didn't have a straight. He's also a trauma surgeon, but he didn't have a straight path as well. So I admire him for what he's overcome, and he inspires me every day. But definitely, like, the other thing is my kids and my wife inspire me. I think those are, so that's five people. Yeah, my mother, my wife, my brother, my two kids. They definitely inspire me.
So awesome, awesome. Well, now we heard a little bit earlier, but who do you hope to uplift with your work?
Oh, there isn't one person, uh, or let me just say everyone. I want my work to have a meaningful and lasting impact in my community, in the local community, the global community, whatever I can do to inspire young people. I think that's probably the one area uh, that I enjoy the most about what I do is this is an opportunity for people to see, uh, a physician of color um, managing an office. And so that's a lot of responsibility. I want to be successful. But I also feel like in my position, I can potentially change people's perspectives and views. It's unique. There aren't many Black surgeons, there aren't many Black vascular surgeons, and there aren't many Black vascular surgeons who are doing what it is that I'm doing now. And I know that's a huge responsibility, um, but I take that very seriously. So I think that's definitely who I want to impact, are the people that I can change their perspective about how things are, and their assumptions can be changed. I'm not in this St. Louis is right in the heartland of the US. And my father was very honest to me, but when I came here, he said, it's going to be tough. And it has been. But there's an opportunity for me to change perspectives, um, you know, about what it is that a Black surgeon or a surgeon of color can do and accomplish. And I take a lot of responsibility from that. So.
Awesome, awesome. You are well on your way. I'm claiming for that you are successful now. You've done excellent work. So, how do you stay engaged with your motivation, or what keeps you going?
Yeah, I think constantly challenging yourself, not always being comfortable with what you know, um, and not being complacent, taking opportunities to not only try new things, but challenge yourself. This is not what I do now is not something that I would have envisioned I was doing 15 years ago. I wouldn't have said, I would have been in an office where this is what I do on a daily basis. But to me, it's such a challenge. I'm so excited by that, and so I think continuing to push yourself, um, particularly in the areas that are less comfortable. If you stay within your lane all the time, sometimes you're not going to be able to grab those moments. One of the actually another mentor of mine, he's a surgeon, vascular surgeon, also an African American vascular surgeon in Florida, and I met him around this time last year. But he since has sent me a book, and uh, and it essentially is, what the book says is you have to take kind of a leap of faith. You have to challenge yourself. You have to be willing to go that next step in order to achieve your goal. And so that's what I would probably impart in some of your audience members and folks that are listening.
Beautiful, beautiful. Last question is, what's next for you?
What's next for me is the next podcast. I don't know. I don't
He's
know.
available when he's available.
Yeah.
Everybody listening.
Yeah. You know what? I don't know. I'm in a very good place right now. I'm just like focusing on what I'm doing here. I think ultimately what I'd like to do is design a program that would allow young people to come in and see what I'm doing right now. Um, Almost like a mini mentorship program, have them come into our lab and be able to see the inner workings, and just have like an opportunity, 3 or 4 kids, maybe one at first, but then we could grow that into a program. I have um, a friend of mine that I work with, and she designed an after school program or actually summer program It's an 8-month summer program. It's a math and science summer program. And when I was in medical school, that's what I did for 2 or 3 summers. And I even came back when I was, I think, a resident. I came back and helped out the kids. But I want to do something like that where I can expose them to something that's a little bit non-traditional in terms of learning, give them another avenue for them to express their talents and to learn things and to question. That's what that would be the next step. If I can do that in the next year, I'd be satisfied.
The Ashe Academy is in full support, and anything you need, let's do it.
Like that.
I'm excited.
Yeah, I
Uh,
appreciate that.
Now, the team listening is wondering, when are we going to find the time? We're going to find the time. We're going to find the people, the resources. We'll do it. So,
That's good. That's great.
absolutely. This was wonderful. Thank you so much, Dr. Pratt. I will
Absolutely.
say, from the moment I started at Modern Vascular, I said I will be talking to this doctor eventually. And it was your business cards was the reason that I had an excuse to just pop up
There
and
you
bother you.
go.
It's like, oh,
That's
Dr. Pratt
right.
needs business cards. Wonderful. Hi, Dr. Pratt. So I'm
I
so
got
glad.
something for you.
Months later, a great conversation. I'm so grateful for you. So,
That's great.
everyone, once again, this is Dr. Pratt, the managing physician, and he is a vascular and endovascular surgeon at Modern Vascular of St. Louis. So, thank you so much, everyone. Take
Absolutely.
care. Be well. Have a good one.
Thank you.